Okay, everybody, Dr. Chris Nelson here today with a follow-up video. So if you look back on my previous videos, I have a bridge versus implant and whether or not you should do a long span bridge versus a 3-unit implant bridge. So if you haven't seen that, you should check it out. This particular case is actually a follow-up. Now, it's not the same patient, but it's almost the exact scenario. And I was able to finish the case and I have photos, so I wanted to share that with you. So what's the big deal about this case? Well, this patient came in and she's a very lovely patient. She has a beautiful smile. She was referred by our partners over at Team Perio, partners in the sense of we work together all the time. And Dr. Blasingame or Dr. Liska had this particular patient come over and she had a long span temporary bridge on some failing teeth. So a prior dentist had worked on the teeth. The dental work was not up to what the patient wanted. The patient wanted another second opinion. Dr. Blasingame and Dr. Liska said, hey, go talk to Dr. Chris. We went through a very comprehensive new patient onboarding process that we do for everybody. And then we worked up a plan. And part of that plan was discerning whether or not we wanted to do implants or a long span bridge. And what we settled on was removing the existing dental work, the temporary bridge, and the existing teeth, and replacing those teeth with 2 dental implants and an eventual long span bridge on top of the dental implants. So a lot of times after the implants are placed, the patient wants something to fill in the missing teeth temporarily. I have a separate video on whether or not you would do a custom temporary or a stay plate, so you can check that out. But in this particular case, our patient actually didn't want to wear a removable appliance like a flipper to replace those teeth. She said, you know what, I'm just gonna go without the teeth and wait for you to make the implant bridge. That's nice because it costs less money. The little removable appliance costs some money to make. And some patients just don't want to wear something removable, especially if you're getting implants. Some people say, if you can make me a temporary implant bridge, make it. But in this case, she said, I don't want to pay for a temporary implant bridge. I don't want to pay for something removable. I'll just have no teeth up there, and then we'll end up making the permanent one. So that's what we did. It took a couple months to have the implants integrate, and then it took a couple weeks or longer to make the implant bridge, especially because we spanned that over the holidays. So, if you go Christmas, New Year's and all that, it ends up making things take longer. So our lab up in Shasta Lake, the Foresters, they made a wonderful monolithic zirconia bridge. And I told them, I said, I don't want to make this a cement retained bridge. This particular patient has a whole bunch of other dental implants and bridges and single unit implants, and she's had some issues with some of them. Some of them were done out of the country, and some of them are of acceptable quality, but not great. And I wanted our stuff to be serviceable. So if I ever needed to take it out and inspect it or look at the other teeth, we could have that option. So I asked the lab to make this 3-unit bridge screw retained. And I said, don't worry about the access holes because I'll use some dental magic to plug up the access holes so you can't see them at all. And that's an issue for some people. We want to do screw retained if we can because we don't have to worry about cement. And if you put on a crown and then it has cement around it, it can cause bone loss in that area. So I said, hey, let's keep this really simple and do a screw retained and don't worry about the access holes, and I'll fix them. So I got the bridge back, and as you can see, the access holes were coming out of the facial or buccal side of the teeth. So they're coming out of the side. And again, the patient was looking at it like, oh, that doesn't look good. And I said, don't worry about it. We'll hide them. I've got some tricks. So we were able to test fit the bridge. In this case, the bridge had a couple little things I wanted modified. So we actually test fitted it. I took some photographs for the lab. I said, hey, let's send it back. They revised a couple things and then sent it back to me. And then we put it right into place. And that's how the dentistry should go. It should just go right into place. maybe with some minor adjustments. In this case, it needed 0 adjustments to the bite, to the contacts, or anything. We just unscrewed the cover screws on top of the implants, put in the bridge, tightened everything down, double checked it, double checked the torque, triple checked it, and then plugged up the access holes with some Teflon tape. And then, this is the cool part, we were able to completely hide the access holes using a really cool product called Omnichroma from a really cool company. So I'll show you some pictures of that. And this, the version of Omnichroma that we used is the blocker. So in my hands, the blocker shade matches monolithic zirconia, especially bright colors, but most every monolithic zirconia, if you're having to bond to monolithic zirconia or cover an access hole, if you SilJet the zirconia, so use a product called SilJet with a micro etcher, you can essentially sandblast it in a special way. I have another video that talks about SilJet, and then you can actually use a bonding agent with a ceramic primer in it, and then Omnichroma Blocker to pretty much completely hide the access holes. And you can see in the picture here, when you look, you can't really tell at all that there's a hole in the restoration. So I even was able to add the cusp tip, the little tip on the end of the tooth, to match the adjacent tooth. So this case turned out really well. She has some other dental work that we might revisit in the future. Like, she has some front teeth crowns that have recession. You can see the recession when you pull the lip out of the way. But in real life, when she smiles, you can't see the edges of the crowns anyways. So it's only an issue for, the dentist, or if she pulled her lip up. And, I think everything looks really good. She was really, really happy with how the bridge looked. I was happy with it. I would have loved if it took less time. I know there are some people that are making the bridges in their office, and, we might do that in the future. But for now, we are really, really happy with working with a professional lab that does custom designed abutments and custom milled crowns. So everything is custom. It's not coming out of a drawer, and we can get better emergence profile on our restorations, that when it goes well, it just goes right in and the patient can clean it really well. And the best measure of success on this particular case is she actually referred, she's going to refer her husband to our practice, which is really exciting. So I tell people every day, I want to make your day better. And part of that is doing great dentistry, but also part of that is making people feel good and supporting them in their decisions and making sure they're making really good decisions. And in this case, I think it was the right choice to do a 3-unit implant bridge, and instead of a really long span tooth-borne bridge. And I think the patient's going to be really happy with it. And yes, it does cost more to do an implant bridge versus something like something removable. That's a separate discussion, but if the budget is there to do an implant restoration, our patients are really happy with those decisions. If you're in the Redding area, Northern California area, we have patients that come all the way from Mount Shasta. We have patients that come from the coast, all the way over Eureka, Arcata area, Trinidad area. We have people that come from the Chico area and all the way out towards Fall River, Bernie area. So if you're in the greater Redding area, I'd love to meet you. And we also are Team Perio. If you haven't been to see them, they're a really great periodontists here in Redding. We really like them. So we work with, I have a lot of specialist friends, and this particular case, like I said, was done with Team Perio. So, okay, you have a great day. See you in the next video.